We know that programs are very confrontational in a misguided effort to break through the defenses of young people and to make them more vulnerable to the messages and the control of the program. We know that youth are often pressured into making confessions about very private acts and often make up stories just to avoid the pressure. In fact, one of the lessons that youth seem to learn is that the way to avoid being hassled constantly is to admit to some heinous act or serious problem, even if the admission is a lie. We know that discipline is extremely strict, and youth are punished for such things as talking to somebody who staff believe they should not be talking to, or making eye contact with the wrong person. In discussing the discipline and abuse within the programs, Representative Miller indicated, "We have heard stories where program staff members force children to remain in seclusion for days at a time, to remain in so-called stress positions for hours at a time, or to undergo extreme physical exertion without sufficient food or water. Based on their study, the GAO concluded that allegations of abuse, some of which involved death, were widespread. During 2005 alone, according to federal data, 33 states which made reports reported 1,619 staff who were involved in incidents of abuse in residential programs. At our university, Dr. Allison Pinto did an online survey of youth and parents in an attempt to determine if, in fact, the complaints about residential treatment were restricted to a few isolated instances. She received over 700 responses, representing 85 different programs in 23 states. While some respondents reported having positive experience, complaints of mistreatment were widespread. So while there are no precise figures on the scope of the problem, there are data from the GAO, from the USF survey, from reports from parents, from staff, and from youth, that the problems are certainly common enough to merit action. In fact, I've been involved in working on some of these issues for long enough that I remember in the 1960s, when the first articles came out about child abuse in the home, and many of us professionals read about it and said, this can't be, this cannot be, this has to be just an extreme case, this has to be an anomaly. And it turned out it was not an anomaly, it was the tip of the iceberg. I really fear and suspect that what we're talking about now is the tip of the iceberg. And while there is an absence of comprehensive outcome data, there can be no more striking outcome than for a young person to die in a program. The GAO initially did a study of the circumstances surrounding the death of 10 youngsters, and then later supplemented it by looking at other cases in which a young person had died. A strong theme in these deaths was the failure of staff to identify when a young person was in genuine physical distress and emotional distress, instead typically considering that their behavior was a manipulation and an attempt to get out of work. In their review of the circumstances surrounding the 10 deaths that they studied in depth, the GAO found 4 striking patterns: untrained program staff, misleading marketing of programs, the occurrence of abuse before the fatalities occur, and negligent operating practices. There is no simple solution to this problem. We meet here today just by coincidence, about a week after the Stop Child Abuse in Residential Programs for Teens Act of 2009, H.R. 911, was passed by the U.S. House Education and Labor Committee, and we certainly thank Representative Miller for his heroic effort over many years on this issue. We're pleased with this and delighted with it, but we recognize that H.R. 911 is only one part of what needs to be done. We recognize that strong licensing laws can be a help, but only if they are accompanied by the necessary resources for rigorous monitoring and enforcement. Otherwise, licensing laws may be misleading, may mislead consumers into believing that licensed programs meet certain criteria that may not in fact meet. We believe that part of the solution will be to develop more and better alternatives to remote residential placement and to educate parents and professionals about these programs, about these options. We clearly owe this to the young people of our country and to their families. We believe another part of the solution is better data collection about the problem and better investigation. The Department of Justice and Civil Rights Division, for example, reports that it receives more credible allegations of violation of youth rights that it can investigate. We believe that another important part of the solution rests with each of us taking action within our own profession, within our organization, within our community or state, to ensure that proper laws and monitoring procedures are in place, to promote the need for effective home and community-based services, to ensure that all treatment programs respect the rights and dignity of all participants, and to educate parents and professionals about these programs and about the importance of exercising great caution before making a placement. In 2001, the Work Group on Child and Adolescent Mental Health of the National Institute of Mental Health declared that no other illnesses damage so many children so seriously as mental illness. And what could possibly be worse than to respond to the legitimate needs of our youth by sending them to programs that cut them off from their friends and families, beat them and humiliate them, and leave them scarred forever and feeling worthless. We have much work to do. Let's move this agenda along. Thank you.